Hi, everyone, and welcome to This is Growing Old, the podcast all about the common human experience of aging. My name is Lindsay Clarke, and I'm the Vice President of Health Education and Advocacy at the Alliance for Aging Research. We're releasing this episode right in the middle of Malnutrition Awareness Week, which takes place October 4th through 8th. If you're listening to this when it first airs or somewhere down the road, we know you'll find it interesting and helpful, so thanks for joining us. Here with me today to talk about malnutrition is Gail Cresci. Gail is president of ASPEN, an organization dedicated to improving patient care by advancing the science and practice of clinical nutrition and metabolism. Gail, thank you so much for joining us today.
Oh, thank you so much for having me. My pleasure.
Yeah, it's great to have you. I know that a lot of people really don't think of malnutrition as something they need to worry about. Can you tell us more about what malnutrition is and who's at risk?
Yes, absolutely. And you're absolutely right. I think we tend to think of malnutrition when we think of people in underdeveloped countries. We see pictures of children who are just wasting or elderly. And that is a form of malnutrition, but there's also malnutrition right in front of our eyes. And we tend not to think about it because someone may not have that visual of being having a wasting-like syndrome. And so malnutrition is really when there's inadequate nutrient intake or protein intake or energy intake. And as a result of that, we can see a wasting type effect, but we also see that these individuals have increased rates of infections, infectious complications, increased hospital length of stay if they end up in the hospital, more likely to get sick. And why we tend to overlook it is even people who may be taking in adequate energy or overabundance of energy, so in obesity. But a lot of these people are not eating adequate nutrients, so the quality of their intake is not good. So they could also have a lot of micronutrient deficiencies that go undetected. And so that's also a form of malnutrition.
So I've heard it referred to as a hidden epidemic in the U.S. And I'm really glad that you pointed out that a lot of times people think of it as something that doesn't happen here, but it's actually quite common. Can you talk about what are some of the factors that contribute to malnutrition? And from the perspective of the Alliance for Aging Research, why is it increasingly common with age?
Absolutely. So really having inadequate access to healthy, good quality food is one of the big concerns. And then in the elderly in particular, they may have access to the food, but for some reason they're not taking it in their bodies. They're not eating, so they may have a swallowing disorder. They may have impaired cognition or functional impairment. They may be depressed. So these are all factors. And then they may have difficulty swallowing. So this is also quite common. And so so they're not able to get or think to get the adequate nutrients in. And then they could also have difficulty with absorption of the nutrients. And so this can then contribute to the malnutrition that may occur on top of if they may have some chronic diseases, other medications they may be taking that are interfering with the ability for them to optimally utilize the nutrients.
So, Gail, why should people be worried about malnutrition? What are some of the potential consequences of malnutrition?
Well, people with malnutrition, no matter what age you are, when we have improper nutrition, our immune system starts to fail, and so you're at higher risk for infections, and then also if you do get some kind of illness, you're more likely to have more complications that result from that illness. If you end up in the hospital, you're more likely to have a prolonged hospital length of stay. And upon discharge, you're also more likely to come back into the hospital in a quicker time frame. Also, it can lead to, it can also contribute to the cognitive decline because nutrition is so important. Like all these micronutrients, our vitamins and minerals, they're really important components of all the biochemical pathways in our body. So when you have deficiencies in these, it's like you kind of view a chain. One of the links are missing, so you don't have a proper connection, and so some of these pathways can start to fail. And we're starting to see and get the connections with interactions with the brain, as well as just overall function. So with muscle wasting, we have decreased muscle function, which increases, association with frailty, which can increase uh, risk of falling. All of these things are just kind of impacted on each other, but nutrition has an underlying foundation of all of these different factors, because it's so important with everything going on in our body.
Right. So it seems like for older adults that malnutrition can really lead to a lot of decline and complications and things that we sometimes think of when we think of aging, and that it makes it so important to detect it and diagnose it. So how is malnutrition detected and diagnosed?
Well, it's really the best way to diagnose malnutrition and detect it is what we call, we ask questions, and we do a physical exam. And I educate medical students on this all the time, and I ask them, when you're doing your physical diagnosis exam on your patient, do you ask them questions about their nutrition? And they're like, no. I said, why? Why not? So simple question, ask someone, have they had any changes in their eating patterns? Do they have any difficulty chewing and swallowing? Because, of course, that's going to impact what they can actually take in their body. Have they had any unintentional weight loss? So unintentional, and it's really in a certain time frame. So it's a percentage of body weight loss in, a month up to 6 months, really puts someone at high nutritional risk. Then when we do, physical exam, we look for if there is any muscle wasting, any fat losses, and subcutaneous fat losses. And then we look for if, let's say, with your diet history, you find that, oh my gosh, this person doesn't eat any fruits or vegetables at all. So they're missing a lot of vital vitamins and minerals in their diet. So then you can start looking for different signs and symptoms of vitamin and mineral deficiency in that individual when you're doing your physical exam. Are they having hair loss? Do their nails break easily? Do they have, cracking, fissures around their mouth and their tongue? All of these things are signs and symptoms of nutrient deficiencies.
So if I were to have any of those or know someone who's experiencing those symptoms, clearly they should bring them up with their healthcare professional. But it seems like they should also make sure they're asking them questions about their nutrition, that they're having those conversations at their visits.
Exactly. And I think a lot of times people tend to just, when we go to see the doctor, we're rushed, and how much time we can spend with the doctor. But bringing up these important parts, and if an elderly person's going to an appointment with a caregiver, it's really important, because then that caregiver oftentimes is the person that's sharing this extra information. Telling, well, you're only eating about half of the food that's on your plate, or you really stopped eating your vegetables, or I notice you're not chewing your food. So simple things like that really can start to, and it's over time that these things start to develop. And this is more in the outpatient ambulatory care setting, but if there's in the setting of where there might be an infection or inflammation going on in the body, all of this process is accelerated. And that's why in the hospital setting, or maybe just coming out of the hospital and going to a rehabilitation center, where some of these things can really be exacerbated pretty quickly.
So what happens if someone has a diagnosis? How is malnutrition treated?
So it depends on what's going on with the individual, but so typically the dietitian will come and see the patient and develop a nutrition care plan for that patient. So depending on what they're if they have a chronic disease, taking in consideration any limitations that they may have, restrictions in their diet, but trying to still come up with a healthy eating plan for them. If the patient is unable to self-consume at least 60% of their nutritional needs on their own, then they'd be and they're at risk for and have, for malnutrition, then they're a candidate for what we call specialized nutrition support therapy, where they may be fed through a feeding tube or get extra oral supplements to supplement their diet. Or they may, if they can't tolerate being fed in their intestinal tract at all, for whatever reason, they may require intravenous feeding. So all of those different care plans are taken into consideration based on what's going on with the patient.
Well, so there's a lot of factors that contribute to malnutrition. So I realize this isn't a simple answer, but can it be prevented? And if so, how?
Well, yes and no. I mean, that's the big question, right? We don't want it to happen. The best way to prevent, of course, if everyone eats great and, takes care of any chronic disease and all of those things. But we know that's not necessarily reality. So when someone comes in, let's say into the hospitalized setting, and they're at risk. So we screen patients on admission to the hospital for risk for malnutrition. That usually comes with two simple questions. I already mentioned them. Have you had any unintentional weight loss? And do you have any difficulty chewing and swallowing? That will immediately trigger some intervention with the dietitian. And then the dietitian may come and do further investigation and assessment of that individual. But a lot of patients may say no, not have any of those problems going on. But then what can happen is what happens medically to the patient in the hospital. And so, like in particular, my area of practice is critical care. So a patient ends up in the intensive care unit. So now I think of COVID patients who end up in the intensive care unit. They have so many other things going on with them to manage their medical care that often nutrition gets pushed aside, and it's the last thing that gets taken care of for the patient. And oftentimes patients can go for days without being fed. And this is where we really are pushing with the Malnutrition Awareness Week to help people to raise awareness that we have to get nutrition on board early. We know that it's very important to start, even in those critically ill patients that have so many other things going on. They have to have nutrition, and it's ideal within 24 to 48 hours of admission to get something going. And so, we're trying to raise the awareness, not only amongst ourselves, but, that's preaching to the choir, but to give, other nutrition focused clinicians resources to help support that awareness at their institution and in their community, that this is important, and to get that word out to administrators, and with billing and everything, that this is so important. And actually, if somebody is adequately diagnosed with malnutrition in a hospitalized setting, hospital systems have realized that this increases their risk of hospital length of stay, increased hospital costs, that they actually give more reimbursement for someone who may be malnourished, to help, because we know that their costs are going to be higher, even though we're trying to do intervention and get things going early to prevent it from developing any further, and hopefully reverse it if we can.
So clinicians are clearly a target audience for Malnutrition Awareness Week. Who are some of the other audiences? And for those that are listening who aren't clinicians, but who want to get involved, can you tell folks how they can get involved?
Yeah, so other ways, like we have with Malnutrition Awareness Week. And by the way, the theme of it this year is nutrition is a human right, which that really means that as a human right, nutritional care is intrinsically linked to the right to food and the right to health. So we're really in collaboration globally, actually, using this terminology to help get the word out across the globe. But really, trying to not only, like you said, the healthcare professionals, but also consumers and patients, to make patients aware, and their caregivers, that they need to ask for nutrition. So if they're in the hospital and you're not getting, let's say your loved one is not getting fed, that's your right to be fed. So to bring it up with your healthcare provider, hey, why aren't you feeding my loved one here? Or why, I have this chronic disease and I'm having issues with losing weight. Can I go see a dietitian to help me work out a meal plan to help me, work through this? And so to ask for that, because oftentimes it's not that people don't want to feed you, it's that it gets overlooked. And so to bring that awareness to the forefront, to the healthcare team, to make sure that you are getting addressed. So it's kind of like taking charge of your own nutrition, nutritional care, not wait passively for someone to bring it up. Just say, hey, I need to eat. They need to eat, they need some
Right.
nutrition. It's simple as that. And then see, and then follow up from there.
Yeah, it's such an important point, and something that we're always trying to underscore in our resources is that we need to be our own advocates, and we need to be advocates for our loved ones. So I'm really glad you touched on that. I know that sometimes, though, malnutrition really is a lack of access to healthy and affordable food. So for those that may be having access troubles, what services should people know about that can help?
Yeah, I think, it's really going to depend on where you reside. There are many programs in with the federal government, actually, that there's different programs. There's program for women, infant, and children. You've heard of those, the WIC program. There's the SNAP program, which is Supplemental Nutrition Assistance Program. There's also for seniors, there's one program termed Senior Farmers Market Nutritional Program, which actually is for low-income seniors to receive coupons that can be exchanged for eligible foods at like farmers markets or roadside stands or other community-supported agricultural programs. There's things like Meals on Wheels.
Mm-hmm.
That is also a nice program that's available. And even within your community, there may be programs. So different churches may, or other resources in the community may offer different types of programs to help with food and delivery systems. So it's really a matter of, looking at governmental sources, but also within your own your own social network, what type of assistance programs may already be in place in your community.
That's great. Thank you. Switching gears a little bit, I wanted to ask you a couple of questions that we ask all of our podcast guests. And the first is, when you were a kid, what did you imagine that growing older would be like?
Oh, wow. I I don't know that I ever thought about growing older. I just kind of think about what I'm going to be when I grow up, more of that kind of thing. But I don't know that I ever, you looked at, your parents and your other teachers and other role models.
Mm-hmm.
Of course, I always thought they were so old.
Right.
When you're a kid, you think that they're so old, and now it's like, oh no, they were younger than I am now.
Right.
So I don't know that I really thought about that. I mean, I always just imagined, I'm fortunate. I have a very active lifestyle. I like to do a lot of exercise. I do triathlons, I do biking, and so I don't know, I guess I never thought that I wouldn't be doing those things. It's just a part of who I am, but I don't know. It's a tough
Yeah,
question.
it's there's people who gave a lot of thought to it. They might have had people in their lives that made them think hard about what growing older looked like. And then there's some of us that just didn't occur to us, right? We thought about the milestones, but we didn't really think about what it would be like for us. But to that point, what do you enjoy most about growing older now?
Um, Oh, I think I enjoy that I'm still able to do things that I can do it now. I'm in charge, right? I can do things that I want to do, um, and make time for it. I think, as you grow older, you have more insights, more wisdom, more knowledge. And so I approach things differently than I did, when I was younger, where I used to just do it.
Hmm.
But now put a little bit more thought, more mindfulness into, hey, you know what? So I'll bring in the context of exercise. It's like, oh, my body doesn't recover like it used to recover. It takes a lot longer to recover. I have to do more preventative things now, more stretching. I do yoga. I do, meditation, all of these things to help me, balance everything in my life. And I didn't do that when I was younger. You just went and I just did it and didn't think about that. And then trying to instill those things into my children who are
Yeah.
grown
Yeah.
in their young 20s now. And of course they're now at where I was, at that age. And so trying to do that, instill that wisdom that I've obtained without them getting, turned off by it, how they don't always want to listen to their parents. But yeah, so I guess I just enjoy that I have a little bit more insight into things. And I tend to listen to older people now. A lot of my good friends are, and who I really enjoy talking with are, 15, 20 years older than me. And I really enjoy, just hearing what they have to say about whatever it may be.
Mhm.
And, if it's a professional thing, if it's a personal thing, if it's nothing, just anything, I just
Yeah.
enjoy that so much.
A lot of people have commented on sort of the wisdom that comes with aging, no matter what our age is. I think that's something we've heard from a lot of people. So I want to thank you for joining us today and sharing some of your wisdom and for being on This Is Growing Old.
Thank you so much for having me, this important podcast.
We're so thrilled to be able to share a little bit about malnutrition. So to everyone, thanks for listening to This Is Growing Old. Our intro and outro music is City Sunshine by Kevin MacLeod. Please subscribe if you're enjoying the show. Thank you and have a great day.